slide?
Yes, sir, it's okay.
Everyone? Okay. So I'll just move forward with that. We'll just have a precautions and the safety in the COVID pandemic. We'll just discuss COVID cases. If you see that there are 1 million cases globally today. It actually originated from a wet animal market, Wuhan, China. It has started with a zoonotic transmission, that it's from a wet animal came to the human being. The symptoms are mainly fever, cough, dyspnea, and diarrhea were there. Clinical presentation ranges from asymptomatic infection to bilateral pneumonitis to the acute problems in the lungs and the chest. Present status of the 5th of the May, there are almost 50,000 cases in India. But the good part is that almost 12 to 15,000 people has already recovered from the COVID virus. But unfortunately, 1,500 patients also died because of this COVID virus. It's an RNA, you can see it's very small, tiny virus, 0.6 to 0.14 micron in size, and that has make the whole of the world affected with that. It's very such a tiny thing, and almost 0.6 to 0.14 micron size of the virus, in which has affected the whole all over the world. It has paralyzed everyone all over the world. And this virus is sensitive to the ethanol, ether, chlorine containing disinfectant, parasitic acids, chloroform, and except chlorhexidine. It is sensitive to the most of the alcohol forms then. And it is also sensitive to the ultraviolet rays and the heat. Mortalities of it is 1 to 10%. The susceptible populations are elderly people, patients suffering from diabetes, smokers, healthcare workers who are exposed to this virus, and the patients affected from this coronavirus. Patients who are having less immunity, they are also prone for that. And patients who are suffering from a respiratory disease, that means the breathing problem patient, or patients suffering from heart diseases, they are susceptible population for this. And WHO has declared this is a global pandemic on 11th of the March, and major procedures are there. So who are at risk, and the senior citizen who are at risk with this coronavirus. What are the main complaint? Patient come with the chest pain and cough. Usually the cough is a dry cough. It is not a wet cough. It is a dry cough. There can be headache. Then mild to moderate fever is there to this patient. Sometimes the pain in the limbs and the upper limb and the lower limb. Sometimes the running nose is a problem, and chills off and on may be there. So these are the symptoms are there. 1 to 3 days patients, once there is a symptoms are there, 1 to 3 days usually there is no symptoms. And the important thing is that we should not afraid of this. 80% of the patient will be asymptomatic, and they just these mild symptoms and they'll get away with that. Only 14% of these patients will have problems in the lungs, and only 5% will have problems in their. And so see, hardly it is 1 to 5%. We have to avoid this virus, but we should not be afraid of this virus. 80% patients recover without any symptoms or very mild symptoms, but the unfortunate part is that during this period, these viruses are infectious to the others. These patients are infectious to the others. So they are. So that is very important. There comes the physical distancing. Is a misnomer word. Nowadays we use the word physical distancing. We have to be away from the person. 5% patient usually require ICU care or ventilation, and out of the 5%, the 1 to 5% patient may die because of this. So that is a physical distancing. Why I'm saying it, that is very important, because when you exhale or when you cough or when you sneeze, so here that is very important of the physical distancing. And you see, when a person exhale, that means when he take breathing, once he inhale the air and once he exhale, during the exhalation, the up to the 1.5 meter distance, the virus can goes and can affect. And secondly, when the person exhale or cough, so 2 meter. There comes the distance of the 2 meter. When you see the media that we should have a 6 feet distance with the person, that means the 6 feet comes from the when a person coughs or exhale. That is the maximum limit. Virus will not automatically jump. When virus is at some places, when virus is there on any object, virus will not jump. It will not airborne. The disease is only droplet transmission is there. That means either by the exhalation or by coughing. So if you are away from the person 2 meters, but this can be up to 6 meters. So that is very important. That is very important thing is that a person is sneezing, so the virus can come up to the 6 meter. So that is social distancing or physical distancing is very important that we have to maintain. Then the virus when comes to our skin, it will not. The only way virus can go to our body is through the eye, through the nose, through the mouth. These are the 5 places from where the virus can go. If somebody touches to your hand, if there is no wound or no cuts in your hand, virus will not go to your body. There are only 5 things: 2 eyes, 2 nostril, and a mouth, because virus will affect the mucous membrane of our body and then it multiply. So 6 feet distance is very important. You can see the 6 feet distance is very important, or a 2 meter distance. And coughing or sneezing, the droplet will go. As I told you, when virus is on any object, it will not airborne. This infection is not airborne. It is a droplet infection. So that is very important that we should maintain a 6 feet distance. Now this is very important of role of the mask. Why the government is so much insisting. Now you see a person suffering from a virus but not wearing the mask. This is the healthy person with the mask. Still the chances of infection getting him is 70%. Only because if that person is not wearing mask. Now come the second scenario. A infected person is with the mask and he is healthy person without mask. See, the chances of infection transmission is only 5%. So that's why whenever you meet any person, always ask them to come to meet you with the mask. And the third situation, when both the person are wearing mask, the transmission probability is only 1.5%. So we don't have to afraid. We have to guide or educate people कि you come with the mask. आप whenever आपके पास अगर बाई आ रही है, ड्राइवर आ रहा है, कोई सर्वेंट आ रहा है, always ask them to wear mask, because mask, any cloth mask is okay, because this will prevent spread of infection. But if you want to protect yourself, then you should have a surgical mask or N95 mask that will protect you. But any made of a homemade cloth mask will help you spread of the infection. Similarly, another side, see here again, the person without mask, chances are very high. With both the persons are without mask. When the normal person is wearing mask, other person is not wearing mask, chances are still high. When normal person is not wearing mask, other person is wearing mask, still spread is medium. And when both are wearing, transmission of infection is very low. Now this is a chart will give you, you can yourself can score points that what are the chances. Like this, if you are receiving paper, if you are receiving something in the poly pack, if you are receiving any person, if you are going to outside, these are all scoring is given. You all can take a screenshot of this and you can yourself score. If your score is 0 to 4, then it is very less likely that you all should, I think, probably take a screenshot of this. This will give you, you can yourself score how risky you are at present. If you are 5 to 10, means you are having mild danger. If your score is 11 to 17, then means you have to restrict yourself. And if your score is 18 to 34, that means you are living dangerously. So you should restrict your activity. That is the very score, I think, probably. You're all getting my point? Everybody is getting it?
Yes, sir.
Yes, sir.
Yes, sir.
Okay. So next is when, as I told you, virus will not run in air. If it is on any surface, so how much it can last in air? It will last in air only for 3 hours. Any metal surface, copper, iron, it will last only 4 hours. In any cardboard, in any paper box or any cardboard box, it will last only on 24 hours. And stainless steel, it will last 2 to 3 hours. It will not run or jump from there. It will stand there. It's an almost a dead body surrounded by a living shell. So it will last there 2 to 3 days. And plastic material, it will last for 3 days. So whatever material you receive in your home, just keep it up that particular object for 3 days and the virus will go. So whatever material you get, if that particular material is washable, like vegetables and all this thing, you can wash and you can. Rest all, anything you are getting in your home, just keep it in a secluded place for 3 days without any treatment, and that thing you can use after 3 days. Okay? Now, when you should wash your hand, they are very important thing. How you wash, I'll also come to that. So when you arrive your home, you should wash. That is very important thing. After coughing or sneezing, you should wash your hand. Before or after cooking, before or after eating. If you have got any pet animals at home, after touching your animals, you should wash your hand. Before or when you contact with anybody, you should wash your hand, and of course, after going to the toilet, you should wash your hands. These are the basic things you should wash. Now the washing is, there are 7 steps of the hand washing. It is shown as 20-second washing. So first you wet your hand, rub your palms together, rub the back of the hand, interlink your fingers, cup the fingers like this. I'll again show the chart. Clean the thumb, rub your palm with the finger like this. So this is a 7-step. First you rub your palm together, rub the back of the hands, interlace your finger and hand together, interlock finger and rub back of the fingers, rotate the thumb, rub fingertip on the palm surface, and then you both wrist and then wash yours. These are the 7 steps or a 20-second washing. That is very important. So that is wash. So what are the protections you require? Wash your hand. When you are sneezing or coughing, use a towel or a napkin. Avoid touching to your eyes, nose and mouth. Whenever you feel urge to touch your eyes, nose and mouth, go wash your hand, touch them, again wash your hand, you're okay. And if you are, so their precautions are, use mask, do not travel, avoid animals, wash your hand frequently, cover your nose and mouth when sneezing, and avoid contact and meeting with the people. Thank you. So I think with that, this is a brief introduction. Now we can take the question answers. I think I was audible and I was clear to everyone.
Yes, sir. Very clear and very extensively you have explained every doubt related to coronavirus, I suppose. Now let us ask students to please ask questions related to what sir has said right now. Yes. By the time sir students think of the question, let me ask you one question. Recently I saw on the news that the asymptomatic, even there are the carriers. So it's very difficult to identify them. So how one can keep safe from them? Like we do not know who is the carrier right now.
Till now, that's very good question. You suspect everyone to be positive. When you go out, you suspect everyone is suffering from coronavirus. Ask that person to wear mask, and you should wear mask and keep a distance of 6 feet. That's okay. There is no, you are, because very difficult. 80% are asymptomatic. So you suspect everyone. Suppose I am seeing patient, I am seeing every patient, I am suspecting that he is a patient of corona. He is suspected suffering from corona. So I am making that this patient, assuming that he is suffering from corona, I ask them to come in the mask. I myself wear a mask and I keep a distance of 2 meters. Don't go close to them, and that you are going for 1 minute, 2 minutes. That the literature says if you are in contact with that person, you should be for 10 to 15 minutes contact with that. 1 minute, 2 minutes you are bypassing, there is no issue with that.
Okay. So one more thing that recently it was told that the new symptoms which have come into notice are the red patches on the body with the
See,
swollen fingers and all.
these are very contradictory reports are there. They are not sure such sign is there. Only sign is that once you have a symptoms for 3 to 5 days, a persistent cough or a sore throat or a fever, then you go to the center and get done the test. That is an PCR test is there. We detect the virus antibodies in your body, and they take it from. This is not a blood test. It is test taken by your nasal swab or a throat swab, and then we test for antibodies those bodies. So that is the only reliable test is there. That is called a PCR test.
Okay. Yes, students, please come forward with your questions. Amreen, Dhanav, Prathamesh, any question to sir related to COVID?
Everything is clear.
Okay. No doubts, nothing.
I think if there is no doubt, then you should all should, if you are agree, then you should take precautions. That is very important, which I told you. Frequently, whenever you go, first thing you avoid going out, but at all if you want to go out, because once the lockdown will open, then we have to require more precaution to be taken. Right now you are at home and you are safe. Once the lockdown is open, then it is very important. Then the risk of infection to all of us is more. So once you start going out, then always wear mask. Without mask, you should not go out. At least keep a distance of 6 feet with other person. And some person is not wearing mask, then you should be keep away at least 2 meters from. And avoid touching your face, eyes, and nose frequently. And frequently, you should have wash your hand. Be positive in life, but be negative with corona report.
Really good saying, sir. Yes, Disha, would you like to ask something? Okay, sir, right now, most of them might be using their coolers and ACs. Is it recommended right now?
See, the central ACs and these are not recommended because this will circulate the airs. The cooler and ACs, if you are using it, you can keep it at low temperature. The only problem with cooler and ACs is that you might get a little sore throat and cough and all this thing. And this will reduce your immunity. So as far as possible, you should avoid or keep them to at a higher temperature. Keep a AC, suppose we are using AC around 28, 29 degrees. So it will just feel comfortable, not cool. But of course, at mall and other places, you should avoid going because their AC, because this AC sucks the air. It's a positive air conditioning is there. So anywhere infection is there, it will circulate everywhere. So avoid going to those places. But at home, you can use cooler, but not frequently. Should avoid exposure to these things.
Okay, sir. We have Sujal here. He wants to ask you one of the questions. Yes, Sujal, you proceed with the question.
Hello, sir.
Yes.
Hello, sir. I just want to ask that what should be the first step to taken if a person thinks he has a corona or a symptoms related to it?
See, the first thing is that if you get a symptom for 2-3 days, for cough or fever, you should go to the yellow hospital. There are yellow hospitals are there. They will go and take a treatment from there. There are designated yellow hospitals are there, like Shelby is there, Suesh is there, Gokuldas is there, Vishesh is there. You first go there and they give you a symptomatic treatment. If they feel, they test you. Otherwise, you don't have to go directly. You cannot go for testing. You just go to yellow hospital if symptoms are there for 3-4 days, persistent fever, cough or sore throat.
Sir, recently...
Sir, I wanted to ask something.
Yes, beta, continue.
Sir, I wanted to ask that how should we treat the vegetables which we are buying right now? I mean, mostly
That's very good question. Whenever you're getting vegetables, you keep them for 20 minutes in a mild hot water and add little bit of the sodium bicarbonate or जो खाने का सोडा बोलते हैं baking soda, you add them and then after 20 minutes you wash them. And
Okay, sir. Thank you.
avoid eating raw vegetables this time. Avoid eating those raw. Always eat cooked vegetable.
Okay, sir. Thank you.
Sir,
Yes.
sir, can this virus get transmitted through water?
No, no. It is not transmitted through water.
Okay.
But it is not transmitted drinking water. But you should avoid swimming pool and ponds and other places going. That is the issue. Because then.
No, the filtering factories that government have, if someone is infected through this virus and that virus, matlab the person gets in contact with that water, so can it?
No, no. They are all rumors. It will not transmit through water. There is no issue with that.
Okay, sir. All right. Thank you.
So one of the tests is coming that if you can hold your breath for 30 seconds or more, then you do not have corona or something. Is this true or?
They are all WhatsApp rumors. They are all
Yeah.
they are all WhatsApp rumors. They got no reliability, and everybody is nowadays more knowledgeable than doctors because of the WhatsApp.
Sir, like you told, for the time period that it would stay on the objects, what about the flooring?
Same. Floor is the same. Floor also, if it is a floor is there, it will last at least 24 hours. But it will not jump from the floor. If it is on the floor, if you touch the floor with your bare hand and those hand, if you touch on your face, then it will come to you. It will remain. As I told you, virus will not jump, or it will not, even with the air, it will not move.
So like if I touch it with my hand, and for how much time it can be on my hand?
If it's hand there, for your hand, it can be up to 3 to 6 hours. So it is better once you touch on the floor, if you are not touching to your face, you are okay. And at any time you go, first opportunity you take and wash your hand.
Okay, sir. Excuse me, sir.
Yes.
Sir, how can we help in increase immunity?
Okay, that's very good question is there. Once you want to increase immunity, is that first you should be properly hydrated. You should at least drink 1.5 to 2 liter of water in 24 hours. Then you should have at least 10 to 15 minutes of exposure to the sun. That is important. Thirdly, you should eat citrus fruits, like they say the lemon, orange. They all have a virus is susceptible to those things. So vitamin C rich food you should take it, and then high protein diet and vegetables. These are way to improve your immunity.
Thank you, sir.
Yes. Anybody else has any question?
So currently, it is in the news that India will develop the vaccine. Like there are 30 tests going on some vaccines. So is there a possibility?
Yes, it's anybody's guess. We can get the vaccine can come earlier, not before 3 months and not before 2 years. So it can be between 3 months to 2 years. We can have vaccine, but it will not be.
But sir, WHO just warned that there may never be a vaccine for coronavirus.
That's what I'm saying. The virus keep on changing its strains. So right now there are even Israel is claiming, even at 5 places in India also the testing is going on. So at present nobody knows what actual thing is there. As I told you, we can get in 3 years and we can get in 2 years. So 3 months to 2 years. But latest we cannot get before July.
And sir, what about that plasma therapy?
That is also under process. It is not. It is also under experimentation. There is no sure evidence that it is there. So plasma therapy is one of the treatment. At present, we are not having a strict treatment against virus. We are only assuming these are effective in certain patients and these are not effective in certain patients. We are not sure of this. If we are sure, then we must have reduced the death rate.
Yes,
so, sir, if it will take around 2 years for the vaccine to develop, how are we supposed to carry on with our daily lives?
See, Corona is not going to go so early. We have to live with corona with all precautions till virus is eradicated, which is very difficult, or till we get vaccine. So the life is going to be changed from we have to live with corona. So we have to take precautions. We have to take all this thing till something miracle happens. Right now, I can not give you. I am giving you very gloomy picture, but we have to live with corona. We have to stay. We have to change our lifestyle. We have to take precautions, everything. And the one positive thing is that uh, when they say when majority of the people will develop asymptomatic corona, when that means the 80% of the world population is affected with that, we develop antibodies against it. So that the time, so we wanted that we all sooner or later will be affected by corona. But we wanted that we should affected late, or when affected, then virus is less virulent. So we should avoid at present exposing ourselves to the virus.
So, sir,
Sir, I just want to ask another question, that if a person has gone outside and after coming, so like he should change the clothes or not?
If he has gone to just market, then there is no need to change. When he is going to market, he has to go with the mask. Preferably, he should use the gloves also. Go out, throw them outside, and come and wash his hand, and then touch the mask and wash that mask and keep it dry. If a doctor or other, when we are going to the hospital or some other places, then we come and we straight away go to the washroom and remove our clothes and wash them. But those you people, when you're going to market and all these things, no need to do that. Only
So,
hand
is there
care.
any need to wear gloves? Because many people claim that it's of no use wearing the gloves.
See, wearing the gloves protect you, and once the gloves is their hand, you avoid touching your face. The gloves will keep you a constant reminder that you don't have to touch your face, or that protection is there. Electrically, it will not go through the hands. Virus will not go, but wearing gloves will keep you reminding that I will not touch my face.
Sir, if a person is suffering from COVID-19, so how long it takes to recover from it?
Maximum period is 21 days.
excuse me, sir.
Yes.
Sir, what is the condition of those patients who were suffering from another disease before and now they are patients of COVID-19?
Okay. See, the effect of COVID on other diseases is not that much severe, but when the person is suffering from other diseases and when he suffers from COVID, the COVID virulency is more strong. So patients' chances of complication or severe disease is more when pre-existing disease is there. That means that person is having less immunity.
Yes.
There was a report which said that the COVID-19 virus is going to be there for 18 months to 2 years.
That is the thing,
So
they are all rumors and projections are there and predictions are there. Nobody knows right now at present. There are many assumptions, predictions are there, and it is anybody's guess right now.
So, sir, if a person suffers from coronavirus and he or she has a better immunity, so there are more chances of his or her to recover from it.
Yes, I am saying that 80% patients are recovering right now. 80% are recovering. If you see at our Arvindo hospital, there are 400 patients are there. Almost 300 patients are asymptomatic. They are on oral tablets, symptomatic tablets. They are lying and moving around here and there. They are comfortable. So we don't have to be afraid of it, but we have to be precautious, have to take precautions with that. It is not a fatal disease. It is a dangerous disease. There are many more diseases which are more fatal than this corona.
Yes. Anybody else?
Sir, this has also been heard that people with good immunity, even if they catch coronavirus without testing or anything, they recover from it. So the next time so the chances will be less of getting virus again.
Yes, that's right. Those persons who have suffered, there are many people who are asymptomatic and they have no symptoms. So you don't know when the corona comes and goes. You don't know. That's right. And also they are having antibodies, so chances of suffering from them next time is very less.
Okay, sir.
Sir, I have a doubt.
Okay, go ahead.
Sir, Italy has claimed that they have just invented the vaccination of coronavirus, and they claim and it is going for medical trials. Is that true?
There's a saying that there are many places the trials are going on. As I told you, we can get in within 3 months also. So there are even at 5 places in India trials are going on. So Israel has also claimed, Italy has also claimed, and PGI Chandigarh, Pune, at 5 places India also doing it. Whosoever is make the breakthrough, we can have this, and there is no issue.
Thank you, sir.
Any more questions?
If there is no question, then I thank you all, and I should leave. I think, madam, it's okay.
Thank you very much, sir. I think it was the most enriching, I would say, the guest lecture, because each and every doubt was cleared with clarity. Thank you very much, sir, for sparing your valuable time and joining it. Thank you so much. And I ask the students even to thank, sir, everybody.
Thank you, sir.
Thank you, sir.
Thank you. It was my pleasure to interact with you. Thank you. Thank you very much.
Thank you, sir.
Stay home and stay safe. Thank you.
Okay. Thank you, sir.